Hello, my name is Eva Reuter, and this is my presentation on neurofibromatosis. I decided to do neurofibromatosis because neurofibromatosis runs in my family, and I have neurofibromatosis too. Neurofibromatosis. Neuro means nerve. Fibroma is fibrous tissue. What is neurofibromatosis? Neurofibromatosis is a genetic disease that affects the nervous system. It also affects bone, soft tissue, and skin. The fibromas can grow anywhere on the body, including the brain and spinal cord. Neurofibromatosis affects anyone, male or female, of any race or ethnic background equally. There are three distinct types of neurofibromatosis. Neurofibromatosis 1 is a mutation of the gene on chromosome 17. Neurofibromatosis 2 is a mutation on the gene at chromosome 22. Schwannomatosis is actually not neurofibromatosis, but is a mutation on the SMARCB1 INI1 gene, a tumor gene suppressor. A neurofibromatosis was first described in 1882 by German pathologist Friedrich Daniel von Recklinghausen as a genetic disorder characterized by a neuroectodermal abnormality. For many years, neurofibromatosis was called von Recklinghausen's disease. Neurofibromatosis is rarely referred to as von Recklinghausen's today. This is John Merrick. John Merrick was a severely deformed man with skin and bone deformities. At the time, leading authorities thought he had elephantitis, a lymphatic disorder that causes parts of a body to swell to a huge size. One side of Merrick's body was so deformed he was unable to use his hand, or he just completely disfigured on the one side. As you can see by this picture, it affected the skull and his skin. In 1976, a doctor wrongly said that Merrick suffered from neurofibromatosis. It was later discovered in 1996 that Merrick had an extreme case of Proteus syndrome, not NF1. NF1 is still stigmatized by this, though, and is still wrongly referred to as elephant man's disease. I found out in 1974, at the age of 16, that I had neurofibromatosis after my sister was diagnosed. In 1976, when it was said that Merrick had NF1, when I saw his picture, I worried for many years that I would end up looking like him too. I was relieved when it was finally discovered what he really had was Proteus syndrome, not NF1. What is neurofibromatosis? Neurofibromatosis, NF1, or peripheral NF, is the most common type of NF. It occurs in every 3,000 to 4,000 births worldwide. There are more than 100,000 people in America affected by NF1. NF1 is more prevalent than cystic fibrosis, hereditary muscular dystrophy, Huntington's disease, and Tay-Sachs combined. As I have mentioned, I have NF1. Neurofibromatosis runs in my family. This includes my maternal grandmother and her only sister, my mother, sister, and younger brother, an aunt, an uncle, some cousins, and their children as well. One of my 4 children, my daughter Cassie, is the only one that has NF. Cassie has 3 girls. The 2 oldest girls, ages 5 and 3, also have NF. Signs and symptoms. How do you know if you have NF1? The diagnostic criteria for NF1, a person needs to have 2 or more of the following: a family history of NF1, 6 or more cafe-au-lait spots, more than 5 millimeters in diameter on a child, and 15 millimeters on an adult. Cafe-au-lait spots are flat patches of skin darker than the skin around them. They are usually present at birth. Leech nodules in the iris of the eye. They kind of look like freckles, and they do not affect the vision. They are pigmented bumps. Freckling in the armpit and groin is another clear sign of NF. Two or more neurofibromas, an abnormal development of the spine, scoliosis, tibial dysplasia, which is a bowing of the leg, an optic glioma, which is an optic nerve tumor, a plexiform neurofibroma that involves many nerves at once. Scoliosis is a common problem with NF, but it is usually mild. Optic gliomas are uncommon. Children with NF should have routine eye exams with an ophthalmologist. My two granddaughters are being closely monitored for these issues each year by a geneticist and with yearly eye exams. So far they only have the cafe au lait spots and the speech delays. Other complications: NF1 can be short stature, shorter than normal, and a larger than normal head, but not grossly abnormal. This does not indicate a medical problem. Most people with NF1 have normal intelligence, but learning difficulties are often common in the areas of math, written language, and speech. Cassie had speech delays, and both of her two girls have the same speech delays. They're both getting help and are improving. My difficulties were, and still is, in the area of math. Cassie still can't spell very well, but she is a Head Start teacher. NF1 is an extremely variable disorder. In the same family, one person may have very few fibromas, and another could have great difficulties because of them. The number and size of the cafe au lait spots an affected person has does not indicate the severity of their NF. The majority, about 60%, have a mild form of NF. NF1 is an autosomal dominant disorder. The cause is a gene mutation that is passed from a parent to a child. Each child of an affected parent has a 50% chance of inheriting the disorder. The gene mutation can also occur spontaneously at conception. This accounts for 50% of all NF1 cases. When the gene mutation is spontaneous, that child will now have a 50% chance for each child he or she has to be affected. NF1, the cause of NF1 is in the gene at chromosome 17. The gene produces an abundant protein called neurofibromin that regulates cell growth. The mutation of the NF1 gene causes uncontrollable cell growth, causing soft tumors to grow on the peripheral nerves. It is still unclear how the mutations in the NF1 gene lead to the other features of NF1, such as learning disabilities and cafe au lait spots. Treatment for NF1: surgery is recommended for tumors that cause a significant cosmetic disfigurement. They don't usually take these tumors off unless they are causing disfigurement, because they are so difficult to remove. They tend to grow back bigger than what they were before. Scoliosis can be corrected with surgery. For optic gliomas, there is radiation and under chemotherapy. Scientists do not know how to keep the neurofibromas from growing. The incidence of learning disabilities in children with NF is higher, with 50%. Once a child goes to school, there is testing that can be done, programs for them. Neurofibromatosis 2, NF1 and NF2 share the same name, but they are distinctly two different diseases. Neurofibromatosis 2 is a more rare disorder, and there are fewer signs and symptoms. It affects 1 in every 25,000 people. Symptoms are not as apparent in children and may be overlooked if there is no history of NF2 in the family. There are no cafe au lait spots on the skin, as there are in NF1. It causes slow-growing tumors on the 8th cranial nerve. They are benign tumors that affect hearing and balance, and they can cause deafness. To diagnose NF2, a doctor will look for a family history of NF2, bilateral vestibular schwannomas, acoustic neuromas, or a unilateral vestibular schwannoma before the age of 30 years, gliomas or meningiomas, and juvenile cortical cataracts. Just like NF1, NF2 is an autosomal dominant disorder. Each child of an affected parent has a 50% chance of inheriting the disorder. The disorder starts spontaneously in about 50% of all cases. The cause of NF2 is caused by a mutation on the gene at chromosome 22. It produces a protein called myelin that regulates cell growth. The mutation causes uncontrollable cell growth. Treatment for NF2 is best managed at a specialty clinic for an initial visit with annual follow-up evaluations, MRIs to reveal the tumors of the vestibular nerve while they are still small. Surgery to remove the entire tumor may preserve the hearing. Surgery can also correct the cataracts. Schwannomatosis, it's genetically and clinically different from NF1 and NF2. The disorder accounts for only 15% of all cases. People with schwannomatosis do not have neurofibromatosis. It is a mutation of the SMARCB1 gene is associated with the form of the disease. It is still not known if the NF2 gene is also involved, though. Symptoms of schwannomatosis are the growth of schwannomas all over the body except on the vestibular nerve. Pain is the main symptom caused by the growth of schwannomas that press on the nerves. Surgery to remove the tumors will relieve the pain. If not, then pain management is the best option. In conclusion, neurofibromatosis 1, neurofibromatosis 2, and schwannomatosis are three distinct disorders, each with its own unique symptoms and causes. There is no cure for neurofibromatosis 1, 2, or for schwannomatosis. Research is being done to learn more about each disorder. And this concludes my presentation of neurofibromatosis. These are my references that I used for my research. A lot of this I knew already because of the fact that I have neurofibromatosis. I knew much of this before I did the research. Thank you, and goodbye.